Today, I have the great pleasure of being joined by David Bomzon, who is, many of you will already know and seen his videos. He's a traditional Chinese medicine practitioner, uses acupuncture. He has a private clinic treating neurological and pain conditions, and also works in a rehabilitation unit in a hospital. He travels around the world teaching the Japanese style of YNSA, which is scalp acupuncture. And today I'm going to ask David to tell us a bit more about his work in his clinic. David, for me as an acupuncturist, I find that neurological conditions can be tricky to treat and can be complex. But I know this is something you work with day in, day out. So can you tell us a little bit about your work in the hospital, in the rehabilitation unit, and the type of patients that you see?
Thank you, Claire, for having me here to explain a bit more about this technique. So I like to say that neurological conditions, everyone treats neurological conditions, even though they put it under the category of pain. For example, what I mean that even if a lot of practitioners that I speak to them, do you treat neurological conditions? And they say, no, we don't treat any neurological conditions. And I say, okay, do you treat someone with migraine? So they say, yes, migraine I do treat. So I say, okay, migraine is a neurological condition in some state. Do you treat vertigo or dizzy spells or nausea? So they say yes. Okay, so that's also a neurological condition, even though you haven't put it under that category. So using YNSA, I started practicing YNSA when I was actually just being an assistant of one of my teachers, and I stumbled onto this method and this technique. You could say it found me when when I finished studying acupuncture. I studied 5 elements and stems and branches. So the school that I came from was very, very categorized, like a one needle technique. So it would cover a lot of internal problems, very, very useful. And I was having difficulty, and the first patients that were coming into my clinic were patients that had pain conditions and neurological conditions. So I asked one of my teachers, who was actually at that time a practitioner in one of the rehabilitational hospitals here in Israel, if I can assist him. And he said yes, and I came to start assisting him. He was also a Japanese practitioner. He was also Chinese. He actually learned in ICOM in the UK. At the same time, he also studied from Kiko Motsunoma, Japanese acupuncture, and he was combining it together in the neurological disorders. So I would see vast treatments in using body acupuncture. You would use a lot of you have seen a lot of stroke patients, peripheral pain conditions, multiple sclerosis, and I was seeing a lot of these treatments on how he was using body acupuncture to treat them, with more success and some with less success. And one day, another practitioner came in that he was actually came to give an in-call for a patient who had a car accident, and she had a traumatic brain injury, and he came to treat her with YNSA. His name was Gil Kotler. He's one of the teachers that was very popular here in Israel for the YNSA method. And Noam, the teacher I was assisting, he asked him, well, if you're here, do you mind treating this patient here that I have that just has a stroke? And they wheeled this, and he said, yes, no problem. And he wheeled him into the room. And a patient had ischemic stroke. He was paralytic on one side of the body. And I remember they wheeled him in, and he had the table on the wheelchair. And his hand was like, if this is the table, his hand was lifted right down on the table. And first thing Gil asked him to do is try and raise his hand. So the first thing he could do before needling, was raise his hand to about a few centimeters off the table. And then Gil done his acupuncture palpation of the YNSA, and asked him again, waited about five minutes, and he asked him again to try and move his hand. And about after 5 minutes, he could raise his hand like maybe 30 centimeters off the table, or maybe not 30, maybe 20 to 30 centimeters off. And I was like, wow, this is amazing. After only using 2 needles, and he got this amazing result so fast. So I went and I started studying it, and I started using it in my clinic. And things came out that Gil actually put me in contact with one of the head of the departments of the rehabilitation or hospital center that I work in today, that she was very interested in integrating scalp acupuncture, especially in YNSA, into her clinic, and she wanted to do clinical research on this topic. And so we started. It took us about a year to get all the permission and start working on this research. And we started actually doing research of 5-year shoulder pain, post stroke shoulder pain, from 1 year to about 5 years, like chronic. And we started using scalp acupuncture with physiotherapy, and we started seeing very, very good results when we were using the scalp acupuncture method. So this was like the first thing, and it was very, very targeted for scalp for shoulder pain. But with other patients, we also charted down the other complaints. So there were patients that had damage to the certain areas like the medulla and suddenly that and they were always feeling that they're sleepy and they concentrate. After about 10-20 minutes, they fall asleep. And suddenly when we started doing the research, then they started saying all these symptoms are starting to disappear. And then also was starting to disappear, and the shoulder pain started getting less and less. The spasticity in the shoulder was less, and even though it was still there, and actually combine it with physiotherapy was making this amazing results on the patient. And then the head of the department, I was only basically there for the research. And then she said, okay, if you're here, we have a vast, we have a lot of patients here in the hospital that have different types of neurological disorder. Could be from multiple sclerosis, could be spinal cord damage, could be traumatic brain injury, but stroke, Parkinson's. So if you're here, why don't we start using it on your free time, go and treat the patients? So actually, I was actually very delighted because she was seeing actually the good results, and she was starting to believe in it, that it was working. And I started working with more of these patients. Now, in the rehabilitation department, it's divided into neuro rehabilitation and orthopedic rehabilitation. So basically, I was mainly doing she was more into the side of the neuro rehabilitation, and we started using a lot and seeing very, very good results on patients, and very, very fast. Like after getting these continuous results on stroke patients, could be just stroke, okay? And we're getting these amazing results or paralysis. And what we started targeting at the same time, we said, okay, if we insert in the scalp the points and they're getting better results. For example, the patient might have more mobility in his hand, or more function in his hand, or even say in the sensory sense, have more sense of feeling in his hand, or standing, for example, and he's standing upright and he's not leaning over because he's got this pusher syndrome and all that. And the physiotherapist was starting to see the results. We said, okay, let's start putting it to use. We'll ask the physiotherapist, what do you want me to target? And at the same time, we'll insert the needles and not go to physiotherapy or do occupational therapy, or if it's necessary, speech therapy. And it was just amazing what we were starting to see there. We were starting to see that the patients were about improving by 30%. And then we started actually testing how scalp acupuncture has an effect on the walking speed of different types of patients, not only stroke patients. So any patient that had some type of traumatic brain injury or some type of neuroskeletal problem, but it was under the category of a neurological problem, how it improves the walking speed. And we were seeing that, again, 30% of these patients were walking 30% faster. So that we are estimating if they're working 30% faster, then we're also going to get the rehabilitational situation 30% faster and even better, and getting better results of the patients. And it's amazing because this is what I've been doing for the last 12 years in the rehabilitation. So you have the classical treatments that is very, very effective for stroke. Parkinson's also, the former head of department was also then was in the department there going under neurorehabilitation due to Parkinson's, and also with him the results were amazing, just using even a very slight protocol. In Yamamoto's method, he has a protocol called for tinnitus. Now the tinnitus protocol is about 4 mandatory points that you use on around the temporalis region, and when we just needle beams on this patient, this Parkinson patient was very, very more stable on his feet. He was less freezing. Okay, he was more balanced out, and even he said he was feeling a lot better. So then so we started also treating at the same time Parkinson patient, and the amazing thing is that they decided the rehabilitation and the neurological department decided to open an external clinic which combines for Parkinson's disease, which is actually a multidisciplinary treatment. And I said, okay, if we do a multidisciplinary treatment that's combined with physiotherapy, occupational therapy. At that time, there was a physiotherapist that was doing medicinal Qigong and Tai Chi. So we also want to integrate that. And the thing is, we must also have acupuncture because we've seen these amazing results in the rehabilitation, and we want it in this clinic. And I can tell you that also there and the patients used to come in for about 12 treatments. So you're looking at 12 treatments over a period of 6 weeks to 5 weeks. Okay, and people that were coming to the clinic with walking sticks were leaving the clinic after these 12 sessions with no walking sticks. Okay, or patients that had some type of freezing when they were trying to cross corridors. Then we stopped seeing the freezing situation. Okay, or they're a lot more balanced, a lot less freezing. They're a lot more alert to what they were speaking about. Now, unfortunately, the effect on which is different on stroke patients, that it actually stays within the results for a long period of time. With Parkinson's, like you have to keep treating them every now and then. It's not that you're gonna heal the disease, because it's a progressive disease of the brain, so it continues to progress the disease. So if we actually just apply, we get to a situation we just apply once every 10 days or once every 10-day scalp acupuncture in this method, and we actually prolong them for a longer period of time in this treatment, so that we get to that situation. And at the same time, then they opened the multiple sclerosis clinic. And then actually the head of the department changed, and there was another head of the department of neurology that changed, and he said, okay, I want also acupuncture in our multiple sclerosis clinic. I said, okay. So the funny thing is that you're saying we don't have needles. And we were like going back and forth for about a couple of weeks, for about 6 months. And I said, why you wanted, why don't we start? He said, I don't have needles. I said, okay, we can use the we can use the needles I have and we can start. So, oh yes, I said, okay. If that's not a problem, let's start. And we started with multiple sclerosis. And again, then I was seeing a lot of patients. They're actually in this clinic. I was combining, started combining body acupuncture, and then using the YNSA method. And it was also, the results was amazing. I remember after a couple of weeks of seeing a large amount of patients that had also the stability and the ataxia, and even the concentration and the paresthesias of these sensations or pain or even spasticity, it actually felt a lot better. And took me about a few months I was working, and after about a couple of months, I saw the head of the department of neurology and said, you don't know, we're just getting amazing feedback from the acupuncture. And just amazing. All the patients are just saying they want the acupuncture, and slowly it's going and growing, and that's what's amazing. And at the same time, also still working in the neurorehabilitation department of the hospital, and that's also amazing, because you see the stroke patients, and you have very good results. Then you see the multiple sclerosis, you see the Parkinson patients, and then in the acute stages, and in the clinics, I see them in the chronic stages. But what's amazing, you see all these types of neurological problems that no one can explain why they appear, but suddenly these patients have them they appear. For example, there was a patient that was admitted to the hospital. He had a nose operation, okay, because of the bone that separates between the two nostrils. He went for an operation for that, and very simple operation, and when he woke up, suddenly he had ataxia. He had balance problems. He couldn't stand. Like, he was starting to show neurological problems. And like, where they brought him to the rehabilitation, and what they basically do in the rehabilitation, they do physiotherapy, occupational therapy, with the idea that they're trying to stimulate the brain, but they were kind of stuck and nothing was moving forward. And there was no explanation why this happened to this patient. So they asked, do you mind using scalp acupuncture on the method, especially, like I said, using the YNSA? And I said, okay, let's start you working with YNSA. And it was just also, there was amazing results. They were having difficulty having him stand, because every time he used to stand, he used to start being very, very dizzy, and he would tend to a side and then sit down. So they couldn't even do physiotherapy of him. And then when we started using the YNSA, he could stand already, and he could stand for a long period of time. He could stand for the session. And just it started moving forward with his rehabilitation, which was amazing as well. So that's just an example of our patients that there's no one knows what they having, but they do know he's having some neurological problem. But when they do this CAT scan or the MRI, they don't see any nerve damage to the brain, or maybe they're not looking in the correct area, and they can't explain it. And then we're using scalp acupuncture and getting these results that are amazing. Unfortunately, this patient that I spoke about, after a couple of months, he was already left the hospital. He passed away from some other neurological problem that came up. But so you see a lot of these treatments. So this instrument, that's what's amazing with YNSA. It's such a simple method. Okay, if you think it comprises of maximum 60 points, but because you're using this body acupuncture technique or palpation certain points, it actually tells you, it's a microsystem, tells you which points to target. And it's so simple. And I think sometimes when you come to these such complex neurological problems, when you give them a very, very simple treatment, the nerve system picks up on a lot faster, and it's just a very amazing and fast result with them. I know sometimes when you come to a patient and you have these, it looks like it's still simple, and you try to treat it and with all these things, it doesn't work. Okay, so that's what I like about it. Even Yamamoto keeps mentioning that, keep it simple, and just palpate here, palpate there, needle here, needle there, and keep it simple, and you get amazing results. And this is just a small example of 12 years of practicing it. And today, like, this whole thing that students that come to see the department or for physiotherapy, then the first thing that they go through, they meet the doctors, they meet the acupuncture, the physiotherapist, and then always the guide of the physiotherapist. No, you have to also speak to our acupuncturist, because it's like the whole integration there, and it's amazing because everyone's like on board on this, and they see the amazing results, and they just want it. All the patients want it, and also the physiotherapist, the occupational therapist, the medical doctors want this actually to be used on the patient, because they've seen these amazing results. The same is when you have neuropathy, the same results. Phantom limb pain, the same results. You're getting these amazing results.
I love the firstly, I love the passion that you're sharing with us, and I love the fact that you've ended up in an environment of multidisciplinary team where you're all contributing, and acupuncture is playing a huge part. Here in the UK, we are not at that stage, and we would love to follow your model. By the time patients with neurological conditions come to see us in clinic, they've had their stroke quite some time ago, or they're quite progressive in their degenerative disease. is there still opportunity for us to reverse some of their symptoms if they come to us at quite a late stage?
Yes, so the rehabilitational situation is when they're in the acute stage, okay? But like the Parkinson clinic and the multiple sclerosis clinic are patients that are chronic. They already a long time they've been diagnosed with it. So it's just a combination. And there the session is built a bit differently. And even my clinic is the same. So instead of having a physiotherapist or having an occupational therapist do the work, I have to do the work in this case.
Right.
So because in my studies, when I finished acupuncture school, I actually went and studied, I done another 2 years of sports therapy and how to, basically it's how to rehabilitate the sportsman.
Mm.
And that's interesting in one manner, but for me, it's the same principles that play out on in a rehabilitation. So because I had those studies in my background, even with just using Twina or simple knowledge, you can do the physiotherapy for yourself. So you can do the acupuncture, then you can, let's say, for example, a better movement of the patient's hand under stroke, and then you can do the passive movement with him. You can do you can ask him to move the hand, or you can even ask a glass. Now imagine these are things that we do in the clinic. Here I can put a glass of water in front of the patient, and I take the same principles. I'm applying acupuncture. Let's say he couldn't grasp the cup, for example. And then suddenly now, after using the scalp acupuncture, he can grasp the mug. Okay, so I could, or slowly, when he doesn't have acupuncture, it's very heavy for him to hold the mug, so he can't even hold the mug. So what I can do there at the same time is, okay, we have the mug in front of you, now grasp the mug. And I'm actually doing visualization with him. I said, okay, try and acknowledge the feeling you're feeling with the mug. Hot, cold, the texture, okay? And then close your fingers. So you actually can do it for yourself. I know before I started working in a hospital and even before my studies of sports therapy, I was doing it myself. I would say a patient, okay, you're having difficulty with, let's say, opening a paper. I would use the acupuncture and say, okay, here's a paper. Let's start working on it, okay? So you can do it for yourself. You don't have to learn physiotherapy or learn occupational therapy to do it. You can do it yourself. And that's what you can do in the clinic. That's what me and my partner, Avi, we do a lot in the clinic. We do the manual therapy with them. If it could be Twina or Shiatsu, or even, like I said, the manual therapy, or even teach them practices they can do at home. So, and it gives the same results. And even if it's a year or 2 years after a stroke, it might take a lot longer to treat, but you'll also get very good results.
Yeah, and that's the key, isn't it? To keep going and finding ways of reminding the brain of the action that needs to happen, and making that connection between the muscles and the brain, and helping people really use all of their senses to get those movements back.
Yeah, like these are topics we cover in our courses. Okay, because a lot of people say, okay, then how do we do it? So we just speak of it's very, very simple. So we speak about these topics, how you can combine in the clinic and really physically take it to a situation and make it very more clinical. And not only think about the acupuncture, because the acupuncture is one part of the puzzle. And doing the manual therapy is the second part of the puzzle. And we often speak about it again and again in the practice, especially in our courses. And even when I gave the webinar, I spoke about it a bit. I spoke about this neuroplasticity.
Yes.
That the brain is constantly changing. So we make it more feelable for the practitioner, so you can see it as well and work with it.
Great. So you told us about how good it is for stroke and for Parkinson's and for MS. What about diabetic neuropathy? What about drop foot? What about some degenerative vision conditions? What else do you see that YNSA is great for?
Okay, so drop foot in general, it depends why the drop. If it's drop foot due to stroke or due to nerve damage. It's a lot more complex to treat because you want to be very, very specific. And as the muscles become more and more specific, comes a bit more and more complicated. So you can improve it, and then you just got to, in some cases, I'll say, look, I'm not going to manage to help you. And then with my experience, I recommend all these props that they can use, or so it makes them help them with the drop foot. But in general, if you start getting into practice, it is effective. It takes a long time to treat drop foot. And we have a specific protocol of points that we target drop foot. Comes from the basic points, comes from the brain points, and another soma at the top of Yamamoto of J and K. So you do get good results with it. And then it just depends on how much the practitioner practices, no matter if it's peripheral damage or even it's central nerve damage. So that's in one case. Diabetic neuropathy. So thinking about it, if we think about it, goes again back, I don't know, diabetic neuropathy, look at the same idea. Okay, the cause of neuropathy is diabetes. If you think about it, what has happened, we have damage to the nerves due to damage to blood supply to the nerves. Okay, so in the end, we're looking at the problem. The problem is damage to the nerves. So we have to regenerate the effect on the nerve. And then we have what's called the epsilon points, and we know, or a kidney point. Okay, we know that the kidney point is kind of a branch out of the brain, of the now is the kidney. So when you have nerve damage, that's what's the advantage of YNSA. You can target the kidney, and the kidney is the whole structure as well with the nerve, or the marrow, helps to build it and helps you do regenerate, or some way regenerate the nerve in some manner, or I don't know if it's regenerated, because the nerves don't usually regenerate, but actually overcome certain areas in the brain that is sending out a signal of pain, for example, in this case. And then even if it's peripheral, get the nerve pain to even lessen and lessen and lessen in the neuropathy. So you actually get very, very good results. Again, that depends where the neuropathy, if it's in the hand or in the foot. Most of the cases in the foot, when they have that feeling of walking on a bubble. So again, there we have a combination of points that we actually add on into treating those disorders. We do the classical protocol of Yamamoto Scalp Acupuncture. And then we have specific points that we target, that we want to target to get the better effect of it. So that's the neuropathy. Basically, you can see there's a lot of, there's only one thing that Yamamoto Scalp Acupuncture has a very difficulty in treating, from my experience. I know spasticity, okay? Spasticity in general, you can get a good effect, but YNSA doesn't hold. If you keep doing it again and again and again, it'll improve with time, because there's some kind of neuroplasticity going on, and then the inhibitors from the brain is suddenly getting back into function. Okay, but it takes a longer period of time to treat spasticity with YNSA than the Chinese scalp acupuncture. Chinese scalp acupuncture, for example, the Korea line, for example, is a lot more effective long-term and short-term than YNSA. So I would say that is one of the falses of the YNSAs that I found in spasticity. And that's why today a lot of times I combine.
Yeah, but you're still using the same microsystems model. You're just pulling in something else that is effective, and that's
what's amazing. Sometimes I even decide to use the YNSA technique on the the needling technique on the Chinese scalp acupuncture, and you also get very good results. So it even makes the Chinese scalp acupuncture a lot more friendly.
Yes. Yeah, a lot more gentle, gentle. So, I mean, the last question that I have for you is, cognitive brain decline is becoming an issue for us all over the world. Probably linked to many things, heart condition, cardiovascular system, hormones in some regard, but nonetheless, there's a lot of research going on, and it is here for for a while. Can you tell us how you get on with YNSA treating mild dementia and Alzheimer's and progressive statuses of that condition?
Okay, so unfortunately, it's also degenerative. We're not going to get the brain to rebuild itself, unfortunately. So
Okay.
we can help them to slower the progress down. In the light stages, you can really get the memory back, or be more concentrated, very fast, or be more in tune. Okay, very fast with the YNSA, because it actually, like I said, you also treat in the channels. So you actually treat in the whole functions of the brain. So that's one manner. Another thing is that you can use also in long term. You might be able to affect certain certain symptoms, but it's you'll get them back to you for a few minutes, but then they go back and forth, and you can actually slow down the progressive situation. But I found that it's very difficult to treat. And in these cases, a lot of times it's not only enough acupuncture. I found that it also have to a lot of times nutrition. Even something very simple that you think that they lack in nutrition is to eat a lot of greens, for example, or even a lot of berries. A lot of my patients say, okay, there's a lot of research going in Stanford about this, about using a handful of blueberries twice a week, that it can or improve, or not only improve, smaller the risk of developing Alzheimer's into the long term. So these are things I speak a lot about with patients. It's not enough only acupuncture. Here, a lot of other tools have to come into play when you dealing with these disorders. So it has an effect, but not as much as an effect as other disorders, I think.
Okay, so early stage is good. That is much better, and it's a combined approach, but a tough condition to treat. Yeah. Okay, good. Can you tell us just briefly the clinical research that you've been doing? Has it been, have I understood correctly, is it focusing on post-stroke symptoms? You talked about the shoulder. Tell us about your research.
So I was doing, every time another new idea of research comes up. But basically, I was we doing a lot of research on the effects of Yamamoto scalp acupuncture on improving the gait, the patient's gait, the walking pattern and the walking, because that's also very important. You think about a patient that's in a wheelchair, tends to with time prolonging to develop more and more diseases, okay, illnesses. So it's very important to try and get them back on their feet and back walking. So we did a lot of research on how scalp acupuncture can improve their gait and improve their walk, because we want to look into the long term in the rehabilitation. Because if a patient doesn't have a problem, he has in difficulty moving the limb, that's less important, what I feel, and also in the rehabilitation, than a patient not sitting in a wheelchair in his long term, what will improving his quality of life. Because you think about the dye channel that now is blocked. You have constipation and have less blood flow. So you want to get as much possible of blood flow running through the body. You want to open up the area for internal disorder problems there as well, the constipation, urinary retraction. So that's very important, and we work a lot about on the gait. Right now, I would say that we're doing less research, because I won't say I won't have the time for it. I just feel that in the end, I feel that sometimes that the research people are more interested in the research than the patient.
Yeah.
And so I'm more interested in the patient. So a lot of times I spoke to the department. I said, I prefer to treat the patient and let's start running when we're going to do research, how we're going to do research. Because there's thousands of researches on what we've done. We can see for ourselves that it's very useful. I know it's very important to put this knowledge out, but I'm less of a researcher than a practitioner.
Yeah.
So kind of we could in the last 3 years our research on hold just because I feel that I'm not in that state, and I was feeling that sometimes my being biased sometimes from the research because I want to prove something so much, and then it affects the treatment.
Yeah, and it stops you being creative because you've got to replicate. So yeah, I understand. David, thank you. You've given us a huge insight this morning into your work in the rehabilitation unit, but for the acute and the chronic conditions. I'm really excited. I find this field absolutely fascinating, and how we can make things work faster is really what we want to do. You know, these are degenerative conditions, aren't they, in a lot of cases, and so getting in there quickly is a great thing. Thank you so much for sharing this. I'm really excited about you coming in February, the 2nd, 3rd and 4th, where we can really get to grips with the palpation, finding those points, how we do the needling, and the protocols that you've talked about, and how you manage the movement as well as the needling at the same time. It sounds fabulous. I can't wait to see you in February. Thank you so much for sharing today.
Thank you, Claire. I'll see you then.